Hello everyone. So today I'm here to share a little story and experience of my life with you all. Since the topic is why I left general surgery, and I think it's not just a topic, I think it's gonna be a question for lifetime. People will ask me why did you leave, and it will be easier for me to refer them all to this video. Even if they all are only 1, 2 or 3 people, that's okay. Let's jump onto the real topic. So the journey starts from the entrance exam. I sat for post-graduation entrance exam this year 2023, and I got the result, and then I applied for the further admission process, and I was actually so ready to take up this general surgery, and I felt this as choice, and I got an allotment letter from one of the government medical college in my own state to pursue my general surgery residency. And the day I got it, my brain was flooded actually with a whole idea, how doubt and dilemma about my future and my lifestyle actually. And then I talked to a few surgeons who are into real practice, and they gave me they share their opinion. And let me make it give you a disclaimer that all the opinion that I'm going to share with you guys are my own. It's not generalized. It's not a general opinion, so it's my own. The thing is, what I concluded was that I really first need to write down my priorities, and on top it's the work-life balance I really wanted. And as a female surgeon, I think I started thinking, and I got as a female, it's if you want work-life balance also, it becomes hectic. It's this lifestyle is actually a bit stressful, because you have to be very passionate, dedicated. I'm talking about becoming a good surgeon, not about becoming just a surgeon for a tag or name. So you have to dedicate your time, your energy, you have to be there mentally and physically both, and invest a lot of time. And you have just 24 hours, and if you're going to invest most of the time, especially in the initial days, you have to do those things. And you have to stand for long hours. This should be your habit. And I actually did not like standing up for long hours and just looking at a closed area, like a certain area. I loved to be in OT in my internship days and in my college days. But I knew at that time, you know what you have to do in internship, that you have to just do your work, enjoy, and then leave. You're not responsible or accountable for anything. But once you get into residency and into the real practice, I think you have to think about multiple things from different directions. And as a female, you cannot avoid some of the innate features. Till the time you are independent, you don't have any family, you don't have any responsibility, you can do anything. But once you get to family, you really want to distribute your time efficiently in each in every domain of your life. And it's so innate in females to look after and care about the family and all these things. And I really am kind of a family person. I think like that. I don't know what happens in the future, but yeah, I think like that. And so and then what I got, the kind of lifestyle I want, I don't think it will give me, because if especially if you really want to become a very good surgeon, yes, you can manage, everything can be managed. And you know what, everyone is living somehow spending their life on this earth, and it's possible to do everything. But you know what, if you have option, why not to look for other things also, if you can get this thing in some other area or some other field, in some other branch actually. The second thing is violence against doctors. It's increasing day by day, and people sometimes do not even, they lose that ethics to behave with doctors or with any professional person. And I know, like, people will say, oh, doctors are also not so good with patients and they're looting this as. I think everything runs in a circle, and one has to, like, both the things are connected, the doctor and patient, and their behavior are like depend on each other. So but there is no law, no protection for doctors nowadays. Like, sometimes you can get such situations in your life, and I am not saying that I won't get if I choose any other field, but I'm saying that it's the probability is higher in this field. And the third thing is that I couldn't see myself like just as general surgeon. I actually started thinking, what if I would go for like some super specialty? Even if I like settle as general surgeon, I think I will have to just settle with these cholecystectomy, appendicectomy, vaginectomy, and all these things, like, and some like C-sections and all these things. And I actually, like, for C-section, vaginectomy, if I had to do that, I will go for like obs and gynae, but I never liked that. In general surgery, I think there's only one branch that is like more fun and kind of not that hectic, is plastic surgery. But for me as a Muslim, otherwise also, I don't feel myself that worthy to make any alteration in the God's art. And there are like many other branches for super specialty also, but again, there's a stress, there's like a long learning curve, and so these things actually were the doubts and dilemmas and the thoughts that were going in my head. I read out all the thoughts to you, and yeah, in the end, as I told you, you first need to know the priorities and sort the things out and break it all down, and then choose some, eliminate some, and that's how you will have to make decision. And in the end, like, it was not easy for me. It took me, I think, 2, 3, 4 days. I was so worried, and my people were not also ready, like my family, and but they, in the end, they were like, okay, you can go for whatever you want to do. So yes, I decided to leave it, and I left. That's how I left the general surgery. And the thing is, now that's it. So if you like this story, or even if you felt connected, please don't forget to like, subscribe. If you feel like, you can do comment also. And I hope to see you guys, like, see you again if I get time and I'm in mood to make videos. Till then, fi amanillah.